Welcome back. Again, I'm Dr. Etienne. I'm a neurologist, board certified in neurology, epilepsy, clinical neurophysiology, brain injury medicine. Uh, for the next few minutes, I'll be speaking about neurology, the brain. This is not medical advice. For any medical advice, I recommend that you communicate with your healthcare provider. So, today, what's on my mind is that earlier this week, I was speaking with a plastic surgeon, and we were talking about what that word plastic means. And the plastic surgeon explained that plastic means that is, and I also just decided to pull the definition out of the dictionary. Plastic means capable of being shaped or molded. And so, for the plastic surgeon, that means something very specific, how they're going to do certain interventions to help someone make certain changes to their body. It could be because the person had some form of an injury. It might be because they want to change their look for various reasons, which we won't go into here. But for the neurologist, the word plastic, it's, yes, capable of being shaped or molded. So, how does that apply to neurology? Well, in neurology, we think of the brain as being an organ that is capable of being shaped or molded. So think back to your childhood or your upbringing, that you were born with certain elements, and you had people who were older than you who were rearing you, teaching you certain things, and changing the way your overall brain works. And really, each of your interactions, each of your engagements with the various people along your path, whether it be your parents, your teachers, your guardians, grandparents, uncles, all these different types of uncles, aunts, all different types of people who had an impact on your life, um, have shaped and molded your brain and changed it, and we hope definitely for the better. Now, this this capability of being shaped or molded is something that actually comes into play, particularly um, after you've had a brain injury. So yes, as you go through your high school, some of you might go to college, or you might go to a trade school. You might learn all kinds of things. This is your brain being shaped and molded. Now, let's say that brain suffers an injury. You're in a motor vehicle accident. You've had a stroke. You've had some other bad thing happen to your brain. Perhaps you were in a sports related injury, where you had a severe traumatic brain injury. All kinds of things can happen. A heart attack, cardiac arrest, where you don't get oxygen to the brain for a period of time. So, after that initial injury, we say, how can we shape and mold this brain to get it back to either what it was, or perhaps something a little bit different from what it was? And so, what are the elements that we're going to use to actually do that? So, after you've suffered a brain injury, it could be from many of the different examples I just spoke about. One, it's critical to have rest. Why is that rest so important? Because it allows your brain a chance to actually recuperate, gives it a chance to recover. It gives it a chance to focus the resources of your body on that recovery process, so that your energy isn't being expended to other things, when really what your brain needs right now is to recover. And really, that rest is important very early on. But we don't want you to just 100% rest, indeterminately. Maybe depending on who you are and what the injury was, you'll have hopefully a medical provider who will help guide you about what is that period of rest. But soon thereafter, you should be engaging in some level of physical activity. Get that blood circulating. By getting that blood to circulate, you're going to get oxygen to circulate and get that oxygen flowing in your brain, because that blood supply is bringing important nutrients to your brain to help with that recovery process. Extremely, extremely important. Then we talk about what I started with, and that neuroplasticity, which is extremely important, because you are going to get your brain to reshape itself. It's gonna make some changes, and really, what depending on your injury, it's not a one size fits all. Um, it's likely going to be that you might want to engage with some form of a therapist, whether it be a physical therapist, occupational therapist, speech therapist if you're having trouble with your speaking, cognitive therapy if your brain is not thinking quite right. You used to be able to do certain things, and now you're finding it difficult for you to think or do those things, or to express yourself. Yes, that cognitive therapist can really help you to regain some of that functionality. So really important for you to engage with these various therapists, and you might even need a psychotherapist depending on different types of trauma you might have experienced. And the psychotherapist is actually very helpful in helping you understand. Perhaps now, after that injury that you've had, you're going to what we call the new normal for you, because you might not necessarily go back to what you were before, but it's still you, just functioning a little bit differently. And a lot of times, I think one of the challenges is when you couldn't do something you were before. Let's say you were a competitive swimmer, or playing some other sport, doing that competitively, tennis, basketball, football, all those different things, right? Rowing, and you are no longer able to do that, or you can't do it the way you did before. Still, that rehabilitation process is important. Work with those various therapists to see what functions you do have. And by working with those therapists, a lot of times you might find out, oh, well, I can't do this anymore, but there's something else interesting that I'm able to do. There's other parts of my brain, and we're using that neuroplasticity to help kind of retrain your brain to do different things. So all is not lost. I think it's really, really important for you to kind of realize that we are dynamic people. Our brains have that plasticity, and yes, you can learn new things later in life. And so, really, really important to keep that in mind as you go through your rehabilitation process. And as you go through that rehabilitation process, one of the things to be very mindful of is what you're putting into your body. So you want to be thinking about, what's my diet going to look like, right? So definitely, one, you might consider consulting with obviously your physician or other medical provider. Think about meeting with a nutritionist or a dietitian to talk about what are those foods and products that are good for your brain. You want to really be putting things into your body that are actually going to be helpful for your brain. And there are certain diets that can be recommended. Diets that are going to be more anti-inflammatory tend to be very good for the brain, because sometimes after that brain injury, you have increased inflammation. So anything you can do to bring down that inflammation can be very helpful. Some people like the Mediterranean diet, right? There's many diets that are available, so you can kind of check them out, see what's going to work for you, look at what you have access to in your community, what types of foods, what types of diets. If there's special certain foods that are akin to your particular culture, you might consider incorporating those and finding out what are the most healthy components of those foods, and particularly the ones that might actually help with my brain health. In addition to that, having those really, really good foods coming into your body, think about toxins to avoid putting into your body. So definitely, after a brain injury, you want to avoid, certain toxins, but particularly illicit substances. Um, Alcohol use can sometimes interfere with that recovery process. So I would say, if you are somebody who will drink on occasion, I would say I would look towards abstaining from alcohol as you go through that rehabilitation process and recovery. Um, Other things to consider is just time. It's you're not going to recover overnight. Yes, there are certain types of brain injuries where the person will recover after just a few days. But for many people, the recovery process can be days, it can be weeks, it can be months, and I have many patients who years after suffering some form of brain injury are still in the recovery process, and are really still, having those tough challenges. And then think about the fact that, there are many instances where, because of that brain injury, there are certain things that you could no longer do. Perhaps you won't be able to go back to the work or job career that you were doing before. Sometimes I have people who might have been in school, and might have to put that on pause. But obviously, you're going to be really consulting with lots of people when you're making those types of decisions. That's going to be consulting with your medical provider, consulting with any academic advisors, any deans, or whoever else it is that helps you make those types of decisions, family members, friends, really complex decisions. Because yes, when a brain injury happens, particularly when it happens all of a sudden, um, it can have a dramatic impact on your life. So there are many elements to that recovery process. So, along with that process, what you also want to be really mindful of is the importance of sleep, right? So as you retrain your brain, and you're kind of capitalizing on that neuroplasticity. Whenever you're going through a learning process, sleep is extremely important. There have been many studies that have shown how it is that sleep actually impacts your learning. We know that a lot of the learning takes place after you've been exposed to the material. Maybe you memorized it, or you learn how to do a certain maneuver. You go to sleep. And after you've slept, we find that that's when a lot of that consolidation takes place in certain stages of sleep. And when you go through those stages of sleep, then you wake up the next day, and that true learning has actually taken place. What we call that, whether it's that motor learning, whether it's cognitive, other information that you're trying to learn, that sleep is extremely valuable. What else does that sleep do? That sleep also cleans out. We know there's a lot of data now pointing to the idea that during some of the deeper stages of sleep, this is also when toxins are cleaned out of the brain. So a lot of times after you've had a brain injury, there are various accumulation of various toxins inside your brain, and so going into sleep and giving your brain a chance to clean those toxins out is extremely important, so you don't have them accumulating. And there's been now increasing data that's suggesting that accumulation of those toxins could lead to other medical conditions down the line. Potentially increasing your chances of certain neurodegenerative diseases. So yes, very important to get that sleep, whether you've had a brain injury or not. So don't think that I'm saying that you just need sleep if you've had a brain injury. You need sleep no matter what. We are very dependent on sleep as human beings, and getting a good night's sleep is extremely important, regardless of who you are, what stage of life you're in, and what you're trying to accomplish. But definitely, it's extremely important when you are recovering from various forms of brain injury. And again, you want to work with your medical providers to find out, how do I gradually increase my physical activity. A lot of times you start with a little bit lighter activity and gradually build up if your body's able to handle that. Also important is having those family and friends around. That emotional support is critical. Social support. I actually run a brain injury support group. I work with numerous colleagues and also some medical students, and we actually run this brain injury support group for folks who are often feeling misunderstood. People don't understand them. People often think that they're faking, lying, and all kinds of things like that. And they come together in a community where they're able to share and bond over some common experiences that they may have had with the traumatic brain injury. So, yes, extremely important. Um, Other things I'll just say is probably one of the biggest important points I always like to drive home for any of my patients, regardless of their backgrounds, when they've experienced any form of brain injury, is recognizing that even if you don't go back to the level of function you had before, there are so many other things that you can still do. And you're going to have to do a little bit of probably some experimentation, try new things, keep an open mind, and you might find out that you had some hidden talents. In fact, there might be certain things that maybe when you were younger you had thought about doing or you were good at before and you kind of left it behind because of the constraints of life. And then now you go back to it and say, oh, wow, I'm still good at this. Oh, why wasn't I doing this before? So pick up those new hobbies. Sometimes you might even find a whole new career out of that self exploration, which is extremely important. The other thing probably the last thing I'll comment on are different types of therapies that I personally like, that I really push for my patients, which are some therapies like music therapy. I think we all know that music often soothes our souls. So you want to really, listen to some really nice, peaceful music to help, stimulate those neurons in your brain and get you feeling really good. Art, I think, is extremely useful. So art therapy. There are many music therapists out there. There's one I work with who I regularly will refer patients to get the music therapy. And then there's art therapy, whether it's engaging in drawing, color by number, or just appreciating art, like going out to a museum or an art show, something, or go watch a show, a dance recital, those types of things. Really, really, really good for your brain when it's going through that recovery phase. Animal assisted therapy. Some people might, whether it be with a horse, sometimes dogs, cats, all kinds of animals can have a very therapeutic impact on patients. Some people like things like dance therapy. You can go and do a dance if you're able, if your body's able to do those movements. I think it's great to engage in that. There's a type of therapy that I like. It's the English translation is forest bathing, but it's from Japan, called Shinrin-Roku, where basically you literally just go in for a walk and immerse yourself with the forest and spend time with that greenery. And you can see how it really kind of like starts to shift that balance. A lot of times after trauma of various sorts, we often see an imbalance between what we call the sympathetic nervous system and the parasympathetic nervous system. And the way to understand these systems is the sympathetic is what people often call the fight or flight response. Often after trauma, this can get revved up. Your adrenaline gets going. And then the parasympathetic is the one that you use when you're kind of about to be relaxed. Think about after you've eaten a heavy, a meal. You filled your belly up, which you shouldn't be filling it up too much. But let's say you've just had a big meal, Thanksgiving dinner. We just had Thanksgiving, right? And now that parasympathetic system is activated to control your digestion. And it also activates to make you relaxed and drift off into sleep, like I saw some of my family members doing after they had their meal on Thanksgiving. But after you've had that trauma, you want to sometimes that balance is off, or the sympathetic is way up here and the parasympathetic is down here. Engaging in these types of activities like meditation, sometimes yoga, all these things starts to restore that balance and get that parasympathetic back up, get that heart rate down, that deep breathing exercise. Yes, these are really, really, really good for your body, good for your brain, good for really everything about you, and really helps to restore some of that function. But these are the things that I wanted to speak to you today. So yes, the word of the day is plastic. That our brains are plastic. They are flexible. Like my one of my senior chiefs always said when I was in officer school, that you want to be fluid flexible. And that's how our brains are going to have to be as we recover from any form of injury. And I think that's where I'm going to stop for today. But if you enjoyed this segment, I encourage you to follow me, like me, subscribe to the channel, and we'll see you next time. And please, if you have any topics you want me to cover, send them my way.